podcast is brought to you by Delta Neural Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneuralhealth.com.
I am a pelvic floor physical therapist. So that means I'm trained as a doctor of physical therapy with specialized education to work specifically in the pelvic region. So I work with men and women who have any trouble with bowel, bladder, or sexual function, or anything related to pregnancy, postpartum, or in general, hips, core, back, etc. I treat, like I said, men and women, any age. Majority of the patients I treat, I will say, are women in their pregnancy, postpartum era. That's certainly not exclusively what I treat, but just based on where my clinics are located and word of mouth, that tends to be the population that I see most often. One of the things that I'll talk with my patients about is just bringing awareness to what the pelvic floor is, right? It's a group of muscles that sits at the underside of the body that works really intimately with other core muscles to provide function, to help support those vital parts of ourselves. Like I said, the bowel, bladder, and sexual function predominantly. So yeah, that's kind of an overview of what a pelvic floor physical therapist is. And what I treat. Symptoms for pelvic floor dysfunction might look like bladder leakage, bladder urgency or excessive frequency, incomplete bladder emptying or bladder retention. When we look at the bowels, that could mean fecal incontinence, that could be constipation, incomplete bowel emptying. We also deal with issues of prolapse, vaginal prolapses, where either the bladder, the uterus, or the rectum is caving into that vaginal canal. Sexual dysfunction might look like pain with intercourse or pain with any kind of penetration. That might also look like pain with using a tampon or a menstrual product, or pain with a pelvic exam from their OBGYN. That also might look like anorgasmia, inability to receive pleasure or feel pleasure. That also might look like, in men, erectile dysfunction. Pain conditions can vary. It can be pain exacerbated by the body from things like endometriosis. So I don't treat endometriosis, but we treat the pain patterns associated with it. Any kind of chronic pelvic pain, vulvodynia, dyspareunia, which is another term for pain with sex. So the list really goes on and on. So there's quite a few things that all surround this pelvic floor dysfunction. In men, I also didn't touch on pain conditions. Testicular pain is a common one that we'll see as well.
Okay. So yeah, so there's really a lot of different conditions that fall under your purview, I guess. I'm always curious, how did you actually decide to go into this field?
Totally on accident. Originally, I was an athletic trainer. So I did my studies in athletic training, and my intention was to pursue a degree in physical therapy and to work in the athletic realm. I really wanted to get into research and working with sports teams. And so that's what my intention was in grad school. And life has a funny way of working out how it's supposed to. A couple of my clinical rotations ended up getting canceled last minute just due to some scheduling issues with the clinics. And I was placed at a women's health clinical, and I had no idea what I was getting myself into. I know we had a couple lectures on it. I did not pay attention to the ins and outs of it because it was nowhere on my radar. So I really didn't understand the complexity of the pelvic floor. I didn't understand how intimate an appointment is, because we do internal exams done by vaginal or rectal exams. So I really was kind of wide-eyed after that first rotation. And there's a taboo nature about it, and it's uncomfortable. And it was just not something that I had ever thought I would be forming my career around. But I had a really great mentor. And I really ended up finding the whole piece of the pelvic floor just fascinating.
Mhm.
It's such a puzzle, the way our body works together, the way
Mhm.
that our biomechanics of our breathing and our hips influence what our pelvic floor is doing. And
Mhm.
once I really zoomed in and looked at that, and then I realized all the other practitioners in my physical therapy field would just kind of ignore the pelvic floor.
Mhm.
I think that culture is changing, but at the time I was going through my studies, I mean, we never really acknowledged it unless you were a pelvic floor therapist.
Mhm.
And so I was fascinated. I also really wanted to work with a motivated population, which
Mhm.
is why I gravitated towards working with the sports population.
Mhm.
And I will tell you, no one is more motivated than my patients who are trying to pee, poop, or have sex.
Yeah,
Like,
pretty
people,
important.
yeah, that's pretty important. And yeah, I really loved it. So after that clinical, it really shifted my career outlook. And in order to become specialized, there's a few different routes you can take. As you graduate physical therapy school, you're a generalist. You can take really general positions. And so I had to go through a series of courses through the American Physical Therapy Association to get to the spot I am today. So
Mhm.
I did my clinical. I ended up taking the 4 levels of courses. I received my designation as a certified pelvic practitioner
Mhm.
through the American Physical Therapy Association. And then through my mentorship at my last job that I was at, I had a ton of hours that I could sit for my board certification. So I studied for my board exam to become a board certified women's health practitioner. So a long road to get there, and really not the path I thought I was going to take, but I'm really glad that it worked out the way that it did.
Yeah, that's awesome.
Yeah.
And I feel that the patients that I work with that are also working with a pelvic floor PT for whatever reason, uh, there seems to be a really high like satisfaction rate. Like
Mhm.
I've never heard a negative thing about somebody
That's
at their
awesome.
pelvic floor PT. It seems like there's always positive reviews and feedback. So yeah, I love that you guys are doing what you're doing in such an
Awesome.
effective way.
Awesome. I do
Um,
feel like being able to I'm sure you see this in your field too. So many of our patients come from practitioners who just do not have the time to be able to sit and talk with them.
mhm.
And so a lot of my patients will come to me, and even with the fantastic care they're getting from their OBGYNs and the health system, I'll get to work with them for an hour every week for multiple weeks.
Mhm.
And you really get to uncover the layers of what's going on.
Mhm.
Part of that's by being an active listener, and by having the effort to show them that there's people in their corner. And part of it too is just the more time you spend with someone, the more time you get to work with them and uncover what's going on with their bodies, the more that answers start popping up at you, and you
Mhm.
can actually fix the root cause. So I do think that's the one benefit of our professions, is that we can actually spend the time and dig deep and get the answers, which I think correlates to high patient satisfaction
Mhm.
in general. Yeah.
For sure. Yeah, and that's why I gravitated towards what I do.
Yeah.
I never wanted to be, with somebody for a couple minutes at a time and, okay, next.
Mhm.
You really, I think, sometimes do certain patients a disservice if that's all they're able to receive.
Yeah.
Um, with pelvic floor PT, I feel like, 20 years ago,
Mhm.
it wasn't such a maybe well-known field.
Mhm.
Um, how do you think it's gained notoriety and popularity? And do you think there's anything maybe environmentally or, the way that we're living our lives that is leading to a higher need for pelvic floor PT?
Yeah. Hard to really say, in my opinion. I'm sure the need was always there.
Hmm.
I think the topic of pelvic floor conditions used to be really taboo.
Hmm.
It wasn't something that was discussed in social circles. And I think just culturally that's changing. I think,
Hmm.
especially when we look at this from a women's standpoint, again, I do treat men, but talking mostly from a women's perspective. Um, it used to be so hush hush if you had sexual dysfunctions or if you had issues where you were, peeing your pants or had prolapse. There used to be this element of shame that really clouded it. And not that that isn't still there, but I think culturally we're talking about it more. We're prioritizing women's health more. Do I think there's a long way to go? For sure. But I think compared to decades ago, even from when I started practicing, the conversations I have with my patients are different. It used to be, oh, I heard about it from my doctor. They mentioned I might try pelvic floor PT. And now the narrative is, oh, I saw something on social media that talked about pelvic floor PT, or I was
Mhm.
talking to my friends and they're going to a pelvic floor PT, or I Googled and it said, find a pelvic floor PT. So I just
Mhm.
think there's more social content out there. Because I think the field of, with the American Physical Therapy Association, I think they said it's been around since the 70s. So it's been around for a
Yeah.
long time, but there haven't been a ton of practitioners. I mean, even in Columbus in the past 5 years, the number of pelvic practitioners has really, really exponentially expanded. So
Very
people are
cool.
talking about it more.
Mhm.
More therapists are interested in going into the field. There's a higher need for it, but I don't think it's because there's more conditions. I think it's because people are finally seeking that help.
Right.
Yeah.
And you had mentioned the connection between breathing and the pelvic floor.
Yeah.
And that's something I'm very fascinated about from a neurological
Yeah.
perspective.
Yeah.
How that may seem kind of unrelated to somebody listening to this. How does, my pelvic floor relate to my diaphragm or my breathing or my respiration? Can you just touch on maybe how those are connected?
Yeah. So I'll usually talk. I'm gonna grab my model out actually. Um, So I usually speak on the pelvic floor in terms of how it functions with the rest of the body. So the pelvic floor itself, it's a group of muscles under the underside of the body that controls bowel, bladder, and sexual function. Okay. It also has a role for pelvic organ support. It has a lymphatic function. So the pumping of the pelvic floor muscles works within that lymph system. Um, and then I think I said this already, sexual and reproductive function, and then it's a
Mhm.
stability muscle. So when we think about our core, I usually have my patients envision a cylinder or a canister. And the bottom of that canister is the pelvic floor. The top of that canister is the breathing diaphragm. And then we have the wall of that canister made up of our deep abdominal muscle, like our transverse abdominis, that
Mhm.
corset like muscle, as well as some of the tiny muscles in the spine. So if we picture that canister shape, diaphragm, pelvic floor, abdominal wall, all those systems have to work with each other to create that inherent stability so that we
Mhm.
can move. If we don't have stability within that canister, right, we wouldn't be able to use our arms and legs because we don't have that pressurized system. And so there's all sorts of different ways that we can recruit stability. We can create tension within our muscles. And we can use our diaphragm. We can hold our breath. And that's one
Mhm.
that usually most people are familiar with. They can picture if they go to lift a heavy object, hold their breath to be able to brace their core.
Mhm.
Um, so, in a stability perspective, they're related. But if we look at what happens when we create that movement of our diaphragm, those two systems move together. So, as you inhale and the diaphragm descends to allow the lungs to fill, we're actually going to see a subtle lengthening of those pelvic muscles.
Mhm.
When we exhale, we're going to see the systems move together.
Mhm.
So, if someone has a dysfunction in their rib cage where their diaphragm can't move through its full range, or they're not accessing it fully, and maybe they're using accessory muscles to breathe, we might find that those pelvic muscles then can't move.
Mhm.
Uh, so there's a lot of connection with that. Kind of going off into another tangent. I know you didn't ask this question, but
Mhm.
so many of my patients come in thinking that, oh, my pelvic muscles are weak. I'm leaking, or I just had a baby, or I have prolapse. I must need to strengthen. And with all of the education out there, I think the one thing that really stuck was Kegels. And
Mhm.
so most of my patients have heard of that term, to strengthen the pelvic floor. And there's this huge idea that we have to tighten everything up.
Mhm.
But I usually will say we need to let the muscle move. So just like my bicep can curl and straighten my arm, the pelvic floor also needs to be able to go through its full range of motion.
Mhm.
oftentimes what I'll see is the pelvic floor can't move as well as it needs
Mm.
to. So when we look at why is the pelvic floor not moving, why is it stuck, we look up to the diaphragm. If the
Okay.
diaphragm and the rib cage aren't moving, we're not going to see movement at the pelvic floor. You can do all the Kegels you want in the world, but if the muscle is stuck and we're just
Mhm.
tightening all day, we're not creating more function.
Right.
Strength does not go hand in hand with function.
Right.
Just because a muscle's strong, if it can't function throughout its range, it's not going to do the job it needs. So I joke with many of my patients that it's more breathing therapy than pelvic therapy at
Mhm.
first, because we have to get those other systems working together.
Yeah.
Yeah.
Yeah. That's a very important concept to understand. Strengthening may not
Mhm.
be the best thing. It's control, it's,
Exactly. Yeah.
appropriate function. Yeah.
Mm-hmm.
And you mentioned just now earlier on in treatment that you're more likely to maybe be doing some breathing mechanics, breathing exercises. What other I guess therapies do you do, or what does therapy look like along the care plan?
Yeah, different for every patient. So my patients will come in for an initial evaluation, and I spend about 90 minutes with my new evaluations to really be able to understand how their body's working. So much of it is going to be understanding their health history, understanding their physical ailments, their concerns. So we spend some time talking through that. I always educate about the pelvic floor and the core. And then I do an exam to look at things externally. I'm
Mhm.
going to look at how their rib cage moves, how their body patterns as they breathe. We're going to look at their core muscles, their hip strength and hip rotation. We're going to look down the chain at what's happening when they move, when they walk, when they turn.
Mhm.
And then if they're comfortable with it, right, it's never mandatory to do an internal exam, but I do it with most of my patients. We'll do an internal exam, typically done vaginally, to see exactly where the pelvic floor muscles are functioning. At this internal exam, I'm able to see if the muscles are tight and stuck, if the muscles are flaccid. I'm able to see how well the muscles can contract, the coordination of their contraction, if they kick in when they cough or sneeze, how they're relating to their hip muscles. So
Mhm.
once we get all that information, we make a plan. And depending on that information, the plan looks different for everyone. But after that initial assessment, I'll usually send my patients home with a couple initial movements, right, that their body needs to help their pelvic floor function. And then at return visits, it's usually a mixture of some sort of hands-on work. I'm a firm believer in treating the fascial system, treating the muscle system, treating our nervous system all together. So
Mhm.
depending on where we might find restrictions, that might look like some work around the rib cage or back or hips or internally at those pelvic muscles, retraining some of that coordination with the diaphragm and breathing,
Mhm.
retraining how to turn on certain muscles. And then there's usually some sort of component of therapeutic exercise. So
Mhm.
strengthening and stretches. I find that I do a lot of breathing work with my patients, a lot of core proper activation, and a lot of glute strengthening,
Mhm.
but not just like tightening the butt muscles, but really figuring out how to pattern the glutes to do movements like hinging and rotation.
Mhm.
Very few Kegels, surprisingly, but so most people are shocked when they come to
Yeah.
pelvic therapy, and I'm like, actually, don't do Kegels because that's not really what your body needs. So not
Mhm.
every case, but most of the time, we're actually looking outside of the pelvis
Mhm.
to try to create a better home for that pelvic floor to respond in. So different for everyone. The amount of time I work with a patient is different depending on their symptoms, but
Mhm.
in general, again, usually some hands-on work, usually retraining the muscles, usually doing some sort of movement.
Very good. And you
Mhm.
had mentioned nervous system control as well as something that you look
Mhm.
at with pelvic floor PT. So how does maybe specifically like parasympathetic versus sympathetic tone play into how somebody responds to your care and what may be leading to some of their problems?
Yeah, great question. The way that our nervous system operates our body can look different from person to person. And so I'm going to give some really general examples just for clarity's sake. If I can picture someone who's really driven by their sympathetic nervous system and they're in that state of fight or flight, that might manifest physically as a lot of excessive tension,
Hmm.
jaw clenching, rib cage clenching, pelvic floor clenching.
Yeah.
And so if we see someone who is in that state of tension and it's driven from the top down,
Mm-hmm.
we can do all the stretching and breathing. But if we're not addressing how our nervous system is managing that tone, we're only going to get so far.
Mm-hmm.
And so those are things we talk about at the evaluation. And if it seems like there's a larger nervous system component, then my patients might have guided meditation for homework, or we might be referring out to additional care to help manage some of the anxieties that are contributing. But it was really fascinating on the intimate relationship between that part of our brain, the midbrain, that's controlling that sympathetic parasympathetic response, and the
Mm-hmm.
pelvic floor. A quick example that I talk about often is the way that we can see that manifest in other animals with tails.
Mm-hmm.
So the midbrain, part of the
Mm-hmm.
midbrain, the amygdala, that processes a lot of that sensory information that our body may perceive as a threat to keep us safe.
Mm-hmm.
That amygdala can send signals in the body to help protect us.
Mm-hmm.
Um, if we look at maybe, let's say, a dog,
Mm-hmm.
and that dog is under threat or they're scared, what does their tail do?
Right.
It tucks.
Right.
If we look at our tail, right, our tailbone,
Mm-hmm.
it's only attached muscularly by the pelvic floor.
Mm-hmm.
I'm pretty sure the dog is not intentionally thinking, "Ooh, let me do a Kegel." Right? It's
Right.
just their muscles are tightening and pulling that
Yeah.
tail in. And so if we can see it in mammals that have a visible tail, we can recognize that our bodies do the same thing. We just can't always see it.
Mm-hmm.
And so if somebody is in a high fight or flight, anxious, stressed, and there's a lot of other factors, their body might be manifesting that physically.
Yeah.
Oftentimes we'll see those clenched pelvic muscles. And
Mm-hmm.
so part of it we talked about could be the diaphragm, it could be compensations for hip weakness or core weakness,
Mm-hmm.
but part of it could be driven from that hyper response from the amygdala. So we have to acknowledge that that's part of it. And we have to talk through strategies on how do we recognize our neural tone and how that's impacting our physical body.
Yeah. And I mean, just look to what people just say in our common vocabulary, I guess, don't clench your butt cheeks, right? Or you're
Mhm.
clenching your butt cheek when you're stressed or scared, right?
Mhm.
Maybe to put it crudely, but
Mhm.
that's kind of our version of tucking our tail.
Yeah.
That's so interesting. I guess I'd never put the two together.
Yeah.
From an evolutionary, like biological perspective, why might a human do that? Obviously, we don't have tails to, yeah.
My guess is that when we're under a state of threat and we're running from our enemy, you don't want to be having a bowel movement.
True. Yeah, very true.
And so our body is holding things in to
Right, right.
create that tension to get us to be able to propel and go, right? The pelvic floor is part of our core. So creating that tension should inherently give us that boost of stability to be able to run, to be able to
Mm-hmm.
focus our energy on other things. But
Mm-hmm.
that is my best guess. I truly have no idea.
Makes sense to me.
Yeah.
Very cool. No, that's really fascinating.
Mhm.
So we've kind of talked about all the different people you might see, the different conditions and whatnot. You know, without getting maybe into too many specifics, because we mentioned everybody is different, everybody has different needs. What are maybe some good general tips for our listeners to maintain healthy pelvic floor hygiene?
Yeah. Great question. I really wish there was like a go-to formula. I could say do X amount of Kegels per day to keep your pelvic floor healthy, but really it's just looking at the balance of our health overall. So
Mhm.
because the pelvic floor has such a relationship with our nervous system and our physical system and our breathing, I usually tell my patients we're not going to see the results we want if our foundation isn't there.
Mhm.
Make sure you're getting plenty of sleep. Make sure your nutrition is adequate. Make sure you're drinking an appropriate amount of water. Create that first.
Mhm.
If I'm working with someone who seems to be under a lot of stress, say those are your three things you got to do first, and then worry about the exercises. Because if we're not filling up our tank, our body can't keep that nervous system in that level state.
Yeah.
So make sure that you have the appropriate sleep and hydration and nutrition. And then it's a balance of flexibility and strength. It comes down to the breathing. Take deep breaths, focus on getting your core and your hips to be strong and flexible. And that should help, if that's 50% of the way right there.
Mhm.
Um, it is hard to give more general advice because we see the spectrum of dysfunction. And I'm going to say some people have dysfunction because their muscles are too weak and they
Mhm.
can't contract. Others have dysfunction because the muscles are too tense and can't function.
Mhm.
So we really would need to figure out which avenue they are. I would say the majority of my patients are the second option. They have more tension. So
Mhm.
it's probably a safer bet to focus more on breathing and down training versus tightening. So
Mhm.
if you're at a loss, breathe, sleep, walk, find
Yeah.
access to your deep core.
Mhm. All those things that you know to
General.
be healthy for you and good for you. So yeah. Yeah. So this has been great, and I know I have learned a lot today, and I'm sure our listeners have also learned a lot as well. For those who are listening are really excited about what we're talking about and what you've had to say today, and would like to maybe get more information or even seek care with you, how might they find you?
Yeah, my practice is called Columbus Pelvic Floor Physical Therapy, and my website is 614pelvicfloor.com, and that's the same as my Instagram handle. So heading to my website, there's a contact form that anyone can reach out to me. I offer free phone consultations. So if anyone has questions or unsure if their symptoms are something I can help with, I'm always happy to chat on the phone and just get a little comfortable with the person that might be coming in and see if it's something that I can help with.
Yeah. 614 pelvic floor. Just
I know
sounds
it
so
really
smooth. Yeah.
rolled off the tongue when I was coming up with it. So yeah.
I love it. Well, this has been great, Alexis. I really enjoyed talking with you today and learning all about what you do, and I'm sure our guests will as well. So really appreciate it.
Awesome. Well, thank you for having me. This was great. And I do appreciate the opportunity to spread the word and get more people knowing about pelvic floor therapy. So, yeah, thank
Of
you.
course. Awesome. Well, for everybody listening, enjoy and take care.